Well, hello again. Hello, everyone. Well, I want to this time I want to talk about a bit about regenerative injections, and especially my experience about it. And since since I'm someone who is hypermobile, which is my joints are super loosey goosey compared to a regular person. Well, I want to share my experience about it and what they use, what they inject to your body. Well, also the first thing I want I want to tell everyone that MRIs are sometimes not accurate. Actually, most of the time not accurate, especially about lower back MRIs. There is tons of data on PubMed research about it, and they all show that the correlation between pain and radiological findings are very, very low. Correlation is very low, and it might it might be it might mean that you might have a bulging disc, degenerative back disease, or something spinal stenosis. Also, keep in mind that most people have bulging discs. It might not be symptomatic. Chances are you have it and you're not symptomatic. On the other hand, let's say you're in pain, your MRI shows you have degenerative disc disease, your disc height is what do you say? Whatever. Your discs are very thin, you're in pain, inflamed, you it says this and that, spinal stenosis, your spinal canal is now narrowed, yada yada. And the reality is, this is the MRIs don't tell you where the painful tissue is. They might give a hint about it. They might say that, this tissue and that tissue might be the source of the pain. But in order to find it, the doctors have to manually check the patient. They have to touch the patients. Which most doctors unfortunately don't. They just enter and log into the computer, take a look at your MRI, and say, well, you have bulging disc and you gotta have surgery, physiotherapy. Yeah, the physiotherapy definitely works, but surgery, most of the time, they just if you do unnecessarily, you end up being in even more pain, or your pain levels just don't change. Well, as I've said in the beginning of the video, I talked a bit about regenerative injections. Well, what I received was called Prolotherapy. And what Prolotherapy is it's just technically sugar water. Yeah, I'm not kidding, sugar water. It's like 10% to 25%. Let's take the average 15 to 17.5% of dextrose, aka glucose, which is your blood sugar, identical to your blood sugar, which they sometimes IV it at 5% concentration, which is quite safe and very cheap, and research show that it just works. And there are conflicting the findings about some research. Some say that it just thickens the ligaments but doesn't increase the strength of them. That's another debate. The how it works is very interesting. Actually, your body's immune system recognizes when it recognizes something, it inflames the tissue. Inflammation actually is a good thing. Good thing, yeah. But in, let's say, physiological range, it's there is no a strict physiological range about inflammation, but you don't want to have too little or too much. Think about having too little, right? Your your immune system is depressed, and now very you're very likely to get sick and get tons of problems about your health. And when it's too high, it increases your risk of getting atherosclerosis and other diseases. You might have joint pain when you have too much inflammation. When you But the interesting thing is your body starts healing cascade via inflammation, which is something very interesting. That's also how prolotherapy or regenerative injections works. Actually, every injection therapy does this by a very similar way. You do inject something into your ligaments or muscle or tendon, right? When you inject it, you create a micro trauma, which is something your body is capable of handling it and healing it. Okay, it does. While it does that, it your you, the healing cascades starts like this. Your inflammation starts to climb up and starts to decline more. Your body deposits more. Let's say the area with problem is your tendon, more collagen, more extracellular matrix. Well, let's talk about a bit about my experience about regenerative injections. Well, beforehand, I also gotta tell you about my history of injuries. Well, unfortunately, I injured both of my shoulders. Technically, I injured my right shoulder firstly, and my left shoulder secondly, and and it took very long time to realize that it was all connected to one thing, which is me being hypermobile, being loosey-goosey. My joints, my tendons, my ligaments are more, let's say, more fragile, more elastic. They don't have the strength of the average one, so it might stretch out over time. And prolotherapy, it's something I consider a godsend thing. And as I've told you, when you introduce your 15 or 20% of dextrose prolotherapy in the injured ligaments and tendons, your tissue inflames, you have pain for a couple of days, and then your pain levels starting to decline, leveling off very slowly, gradually. It, it depends on which body parts your doctor injects, but in general, I would say in 3 weeks you start to realize that that's interesting, right? I don't have the same level of pain. It's decreased, or it has just starts to decrease. And in hip joint, in my experience, it's a bit different. It takes at least a month to get rid of the pain or the increased inflammation to get the baseline almost. Let's be realistic. It takes 2 to 3 weeks to inflammation to get to the baseline levels, and for the pain relief I start to feel pain relief at 8 week or so. In my experience, hip joints are one of the most painful areas to inject prolotherapy, of course, in my experience. And the other thing I wanted to I want to tell that whether you inject PRP, bone marrow aspirate concentrate, your stem cells from birth tissues, you have to use a needle, right? Your doctor has to use a needle. When it uses, it starts, it has it microtraumas the area, and the area starts to inflame. But that's the short-term response. When you look at the long-term response, 2 week, 3 week, month, and a year after the injection, it actually decreases the inflammation. And the areas I got the injections are both of my shoulders, my right knee, my left hip, and my sacroiliac joint, the right area, the right sacroiliac joint actually. And the histories and the how I hurt my shoulders are the dumb thing I did is all about the dumb things I did while I was working out like 5-6 years ago. And the how my if you ask how I injured my right knee, I have no idea, but for my left hip I have, which is, at least I think that it is a supporting idea that I have a tendency to injure my tendons, ligaments, or joints in general compared to a regular person. And here is how I injured my hip when I was going to gym, like almost 5 years ago. There was a construction site nearby my home, and the funny thing is, they dug up a hole in the pavement. They didn't put a sign, and lightning pole was not working. The area was dug, and as I was walking, my feet caught in just that half a meter deep hole and twisted my hip joint. And the second when my foot just contacted with the very bottom of the hole, I immediately felt a pain in my left hip, which didn't go away for an hour or so, and the pain leveled off eventually, but didn't go back to baseline. It kept at being like 20%. I always had it, let's say, 1 or 2 out of 10 pain levels in background constantly, which is something annoying like that, right? That's what it's called, chronic pain. Well, as I've found about prolotherapy and being hypermobile, thank God, after a couple dozens of doctor visits, well, I started to get injections to my shoulders. Well, my shoulders responded very well, actually. Well, now when I externally rotate my shoulders, they don't feel like they are going to dislocate. Also, I gotta mention that previously I've had 2 surgeries on my shoulders, which are still they are still a mess, but less of a mess now. It's surgery I had is the capsular application, you might call capsular shifting, anterior capsular shifting, because my shoulders there was a micro instability towards posterior to anterior, which means my shoulders was given a bit loosey. There was a more play towards the front, the anterior part of my shoulder. Well, also, what they did with prolotherapy is the strengthening of the ligaments, right? They injected the IC joint, acromioclavicular ligaments, coracoid process, the superior, middle, and inferior glenohumeral ligaments, and glenohumeral capsule and subscapularis and supraspinatus tendons. While it did not, the amount of prolotherapy sessions I had, my shoulders are, I guess they are 6 or 7 in total. They didn't worked as much as I expected, actually, but in my SI joints it worked like a miracle. Actually, it worked like a miracle. My SI joint used to ache almost all the time. I've had nights that I couldn't even sleep even 1 minute because of the dull ache, and it sometimes used to feel like I have sciatica, and my piriformis used to get super tight, which is also one of the indicators of instability of the SI joints, because when something is lax, when there is a more play in the joint, what your body does, your body has a protective mechanism. Like when you tweak your back light, your back muscles spasm, right? They contract. The exact same principle applies to the other joints. My piriformis would get so tight that I would have sciatica problems. The pain shooting to almost to my heel. Also, I want to mention that there's something called pseudo radicular pain, radiculopathy. It's sciatica pain is a radiculopathy, and pseudo-radicular pain is something mimicking the radicular pain. And lax ligaments can mimic the radicular pain, which is called pseudo-radicular pain. And I've had 2 injections at first in my right SI joints. After my first injections, I had 50% pain relief. After my second, I've had 100% pain relief. And the pain relief level of, let's say, a 6 month or 7 months after this second injection, and the improvement was about 85 to 95%, depending on how I feel. And like 3 to 4 months ago, I had my third injection. I haven't had pseudo-radicular or radicular pain in my SI joint. And besides the radicular and pseudo-radicular pain, I did not even have a dull ache in my SI joints since the last injection. And I gotta say that it seems like, especially for the EDS and collagen deficient patients, like EDS patients, the SI joint is one of the body parts that prolotherapy works the best. Well, the questions comes to this, right? Naturally. Do I recommend it? Yes. The reason is it is super cheap. We are talking about just $1 cost about prolotherapy. 1 syringe is. You might think about 1 syringe is $1. Actually, in my country, it costs, I would say, something like 10 cents for a syringe or so, including this syringe price, right? Price of the syringe. The cost is very low, and it requires it requires a knowledgeable doctor about your body parts. Your doctor has to check if you have a tender body part or not, and they might use ultrasound, especially for somewhere which is very rich with neovascular structures, especially in those areas. They might better off using ultrasound, and they use C-arm fluoroscopy, which is X-ray, live X-ray, and they are all helpful. But in my experience, the ultrasound guided prolotherapy is not something mandatory about mandatory for let's say a very superficial level injections and body parts that physician can actually feel, touch. Let's say for your, I don't know, camera sees or not, like your golfer's elbow, right? Your tennis elbow, golfer's elbow. They might inject it. The interesting part is this: when you have a tear, and if they want to inject the area, unfortunately they have to use an ultrasound. And also, as someone who's really into the biology and pharmacology, I want to mention that historically they used glycerin, however you pronounce it. I don't know how exactly how to pronounce it. Glycerin, phenol, and as some of you might know, phenol is in insulin to keep it sterile. And there are also use sodium borate, I guess it's called. It's sclerosing agents. They also tend to use sclerosing with very strong proliferants, sclerosants for EDS patients, since they don't have healthy connective tissue. And the other things that's also used for PED, performance enhancement, works some drugs that works as a PED also works in prolotherapy, regenerative injections, and those are, some doctors use testosterone as an irritant, as pure testosterone suspension, and some doctors even use pumice, which most doctors don't. And some doctors use growth hormone addition to prolotherapy. Some doctors actually, the interesting thing is, I was going to say that some doctors use EPO, and that's unfortunately that's not true. Some doctors don't, and there are recent research that show that prolotherapy, intraarticular injections with EPO, is superior to intraarticular injections of just dextrose prolotherapy. Keep in mind that EPO works by JAK-STAT pathway, which is how also growth hormone works, and there are histology research show that locally injected EPO with injured tendons, or surgically repaired tendons with injected of locally EPO, are histologically and sometimes their strength tissue failure to strength to failure, sorry, my bad, strength to failure are superior to the systemic injections. And keep in mind that some doctors might not want to use those injections, and that's fine. If you want to find a doctor who wants to inject those, you gotta maybe try 4 or 5 prolotherapy doctors, or doctors who use prolotherapy, and it might be pain in the butt, but it almost worth to try and have different ideas and to find a doctor who asks you a lot of questions, and you can question, even you can question, of course, kindly. The last thing I want to say that about how also PRP and bone marrow aspirate concentration works is they also work by inflammation, as I've said previously, and they, in addition to inflammation or needle trauma, they also have additional growth factors. A bit of PRP has tiny bit of stem cells, and like platelets, right? They're all helpful. You might think that prolotherapy is ancestry as an ancestor of PRP, and you might think that PRP is an ancestor to bone marrow aspirate. Even some doctors use birth tissue umbilical I can't pronounce it still, umbilical stem cells or some other things. And if you ask me, if I were you, I wouldn't start with prolotherapy. It is just fancy prolotherapies, fancy PRPs, fancy bone marrow aspirate concentrates. If you have, let's say, little damage and your issues are mostly laxity, you don't have fractured something completely, before going on a surgery, try simple old sugar dextrose prolotherapy, which is quite cheap, and you might delay your surgery like even a decade. And also anecdotally, the ones who I recommended prolotherapy, my friends or my family, dads or mothers of my friends who did prolotherapy because I recommended, are thankful, because it's quite cheap and works. And the only annoying part is it just hurts for a week or so, which is nothing when you compare it to let's say chronic pain, right? Chronic, when you have chronic pain 24/7, you are in pain and you don't want to go out. In prolotherapy, it might change those things very, very rapidly, very simply. But the conclusion is quite cheap. It's dirt cheap. You can almost find a doctor who does that in, I would say, even in some third world countries. And last thing I want to add is, if you want to have a prolotherapy and you have some question marks in your head, you're not sure, and you want to talk about someone who had prolotherapy, just drop a comment in the comment section down below. I would like to answer your questions. Till next time, goodbye and have a great day.